soft tissue of the upper limb. Soft tissue of the upper limb. At first, after removal of the skin, you can see two veins. In this figure, you can see. There are two veins into the superficial fascia of the upper limb. Superficial fascia of the upper limb. Lateral vein, this one, is called cephalic vein. Medial is called basilic vein. Both of them arise from dorsum of the hand. There is a venous plexus. In dorsal of the hand. This venous plexus is called dorsal venous plexus. Okay? Dorsal venous plexus. In lateral side, cephalic. In medial side, basilic vein arise from dorsal venous plexus. Why? These veins are called cephalic and basilic. When your upper limb is hold here, this position, this vein is near to head. For this reason, it's called cephalic. This vein is near to base. It's called basilic. Okay? Cephalic vein, basilic vein. The basilic vein ascends into the upper limb, and in midpoint of the arm, pierces the deep fascia and is changed to axillary vein. In this figure, you can see cephalic and basilic. Cephalic in lateral side, basilic in medial side. Basilic ascends into the upper limb, and in midpoint of the arm, pierces the fascia and is changed to axillary vein. In this figure, you can see this one is changed to axillary vein. Okay? The cephalic vein drain into the axillary vein. The cephalic vein drain into the axillary vein. In front of the elbow, cephalic vein connect to basilic vein. This vein is called median cubital vein. Median cubital vein is very important in clinic. Median cubital vein is one. Okay? It's important in clinic because blood sampling and venous injection to here. Okay? Blood sampling and venous injection to here. Okay. Cutaneous nerve or superficial nerves. Cutaneous nerves of the upper limb in anterior view and posterior view. All of them are upper lateral cutaneous nerve of arm. Lower lateral cutaneous nerve of arm. This one is arm, okay? Lateral side, medial side. Lateral side innervated by two nerves. Upper part by upper lateral. Lower part by lower lateral cutaneous nerve of arm. Upper lateral is a branch of axillary nerve. Is a branch of axillary nerve. Lower lateral is a branch of radial nerve. Radial nerve. Medial side is innervated by medial cutaneous nerve of arm. Medial cutaneous nerve of arm is a branch of medial cord. Medial cord of brachial plexus. Medial cord of brachial plexus. Forearm. Forearm. In lateral side innervated by lateral cutaneous nerve of forearm. In medial side is innervated by medial cutaneous nerve of forearm. Medial cutaneous nerve of forearm is a branch of medial cord of brachial plexus. Brachial plexus. Lateral cutaneous nerve of forearm is a branch of musculocutaneous nerve. Musculocutaneous nerve. Palmar surface of the hand. Palmar surface of the hand. The palmar surface is divided two parts. 3.5 fingers. 3.5 fingers laterally is innervated by median nerve. 1.5 medially is innervated by ulnar nerve. Anterior of the upper limb. Hand, palmar surface of the hand. 3.5 lateral fingers are innervated by median. 1.5 medially, ulnar. Lateral side of the forearm. Lateral cutaneous nerve of forearm is a branch of musculocutaneous. Medial side of the forearm is innervated by medial cutaneous nerve of forearm is a branch of medial cord of brachial plexus. Lateral side of the arm. Lateral side of the arm. In upper part, yes. In upper part is innervated by upper lateral cutaneous nerve of arm is a branch of axillary. Lower part is a branch of medial. Medial side, medial cutaneous nerve of arm is a branch of medial. Posterior surface. Posterior surface. In lateral or medial side, innervated by same branch. Okay? But in middle part is innervated by posterior cutaneous nerve of arm and posterior cutaneous nerve of forearm. Both of them are branch of radial nerve. Okay? Dorsal surface of the hand. dorsal surface of the hand. 3.5 fingers laterally. 3.5 fingers laterally, this one. 3.5 fingers laterally is innervated by radial nerve, and 1.5 medially is innervated by ulnar nerve. Ulnar nerve. Anterior view, posterior. Both of them is right hand. Okay? This one anterior view. This one posterior view. Name. Okay? What is dermatome? Dermatome. In this figure, you can see lateral side of the arm is innervated by upper lateral and lower lateral. Lateral side of the forearm is innervated by lateral cutaneous nerve of forearm. Medial side is innervated by medial cutaneous nerve of arm and forearm. Hand is innervated by medial and ulnar. But you can see lateral side is writing C5. Lateral side of the forearm is writing C6. What is this? This one is dermatome. What's dermatome? Dermatome is the special area of the skin. A special area of the skin is innervated mainly, not only, mainly by single spinal nerve. Okay? For example, C5, C6, C7 contribute to formation of, for example, musculocutaneous nerve. Musculocutaneous nerve. Okay? This one innervate lateral. This one innervate lateral side of the forearm. Which of them are dominant? Which of them are dominant? C6. Okay? C6 spinal nerve is dominant for innervation of cutaneous of lateral side of the forearm. Okay? You must memorize dermatome of upper limb. For memorize. This muscle is deltoid. Skin over deltoid muscle is innervated by C4. Okay? Lateral side of the arm and upper part of forearm is innervated by C5. Lower part and thumb is innervated by C6. Three middle fingers is innervated by C7. Little finger is innervated C8. Medial side of the forearm T1 and armpit T2. C4, C5, C6, C7, C8, T1, T2. Okay? Why we need to memorize dermatome of upper limb? For example, test my sensory innervation of upper limb. Me. You are a doctor? Okay. Test my sensory innervation of upper limb. T2. Lateral side. C6. Little finger.
C7.
Thumb.
C6.
Middle finger.
7.
Okay? It's very easy, but it's very important.
Hocam C3
Two. Two.
ince T2, ince T3.
No. Upper limb. Upper limb. My course is upper limb. This one is trunk. Okay? Which nerve innervate? Which nerve? No. Which? Spinal nerve. Which nerve innervate armpit?
D2.
No. This one is trunk. Okay? A nerve from second intercostal space. Second intercostal space connect to armpit. This nerve from second intercostal space is intercostobrachial nerve. Intercostobrachial nerve. Okay? Because it's between costal space and brachial. It's called intercostobrachial nerve. Contain which spinal nerve is dominant part? 3 or 2? T2. Second intercostal space. Second intercostal space contain T2. Okay. This one is false. T3 no. T2. Okay. At this time, we begin to study shoulder-gilder muscles. Shoulder-gilder muscles. These muscles connect the upper limb to axial skeleton, sternum, ribs, vertebra, and skull. In anterior view from superficial to deep, we can see this muscle, pectoralis major. Pectoralis major, origin from sternum, ribs, and clavicle. Origin from sternum, ribs, and clavicle. Okay. This fiber move laterally. These fibers move laterally, chain to tendon, and this tendon attached to lateral lip of intertubercular groove. Lateral lip of intertubercular groove or sulcus. Pectoralis major because it's very large, attached to thorax. What's function of this muscle? This muscle is adductor, medial rotator. Clavicular part is flexion. Okay. The function of the pectoralis major is flexion, adduction, medial rotation. Okay. Touch pectoralis major. Touch your pectoralis major. Touch. Okay. Medial rotation. The muscle is contracted. Is bulk. Okay. Adduction is bulk. Flexion is bulk. This muscle is pectoralis major. The pectoralis major is innervated by lateral and medial pectoral nerves. Lateral and medial pectoral nerves. When we cut pectoralis major, we can see pectoralis minor. Pectoralis minor. The pectoralis minor origin from third, fourth, and fifth ribs and move upward and insert into the coracoid process. Coracoid process. This muscle is a depressor of the shoulder. Depressor of the shoulder. This muscle is innervated by medial pectoral nerve for memorizing. Pectoralis minor is innervated by medial pectoral nerve. Pectoralis minor is innervated by medial pectoral nerve. Above it, between first and second, between first rib and clavicle, you can see subclavius muscle. Subclavius muscle origin from first rib insert to clavicle. This muscle is innervated by nerve for subclavius. This muscle is innervated by nerve for subclavius. The function of this muscle is the most function is stabilize these joints. Stabilize sternoclavicular and acromioclavicular. Prevent to clavicular dislocation. Clavicular dislocation. Okay. In lateral side, this one is pectoralis major, origin from sternum, ribs, and clavicle. Insert to lateral rib of intertubercular groove. This muscle is innervated by
Media and lateral cutaneous nerve.
This muscle is very large, for this reason it has two nerves, medial and lateral pectoral nerve. The function is adduction, irregular rotation, and rejection. Insert, move toward origin. Insert, move toward origin. Pectoralis minor, origin from third, fourth, fifth ribs, and insert to coracoid process. Okay? Insertion, move toward origin. For this reason, you can see depression of the shoulder is innervated by medial pectoral nerve. Okay. Deltoid muscle. Deltoid muscle. Deltoid muscle.
deltoid muscle عبالة قلب معلق شكل
Okay. What is this? This one, spine. This one, acromion. This is acromion continuation of spine. Okay. Deltoid muscle origin from clavicula, acromion, and spine of the scapula. Okay. This muscle origin from clavicle, acromion, and spine of the scapula. This muscle insert to deltoid tuberosity. Deltoid tuberosity. In midpoint of the humerus. Okay. Deltoid tuberosity. This muscle is innervated by auxiliary nerve. The function of this muscle: clavicular part, flexion; spine part, extension; acromion part, abduction. The function of deltoid is flexion, extension, and abduction
of the forearm
shoulder joint, glenohumeral
shoulder.
or humerus. Okay? flexion, extension, abduction of shoulder joint. Other name is gelatohumeral joint, abduction, flexion, or extension of arm. Okay, all of them are same meaning. The deltoid muscle is important for intramuscular injection. In COVID period, okay, all of us have experience of vaccination. Okay, this vaccination do into the deltoid muscle. Which part of deltoid? Upper part or lower part?
Upper.
Lower part, because upper part is very dangerous. Deep to deltoid in upper part, you can see auxiliary nerve. Lower part is safe. In this figure, you can see lower part is safe, upper part is dangerous. Posterior muscles.